Imagine you're just sitting there looking at a stack of glossy medical brochures on a clinic waiting room table.
Right.
You open the first one, and it outlines this highly complex, minimally invasive surgical procedure to to remove a human kidney.
Which is an absolute marvel of modern life-saving medicine, really.
Exactly, it's a miracle. But then you pick up the exact next brochure, and it's advertising a lunchtime walk-in, walk-out procedure to inject hyaluronic acid dermal fillers into the outer lips of a vagina.
Yeah. The juxtaposition there is just wild.
It really is. So today we are bringing you into the explosion of female genital cosmetic surgery, or FGCS. And our mission for this deep dive is to, cut through the marketing spin and the taboo to understand what is actually happening.
Because it's a massive shift in how we approach the human body, and we are synthesizing a truly diverse stack of sources for you today to figure this out.
We really are. What are we looking at?
Well, we've got clinical guidelines from NICE, so the National Institute for Health and Care Excellence, alongside data from the British Association of Aesthetic Plastic Surgeons,
Right.
plus expert consensus papers from MedCrave on gynecological injectables, various brochures from these high-end cosmetic clinics, and, as you mentioned, that rather surprising clinical overview of laparoscopic kidney removals.
Yeah, we are definitely going to circle back to that kidney surgery connection later because the technological link there is actually profound.
It really is.
But the core focus for us today, the procedure we really want to unpack for you, something called a labial puff.
Yes, the demand for this is just surging right now.
I mean, women are literally walking into clinics on their lunch breaks for this.
Yeah.
So what exactly is it? And the most pressing question we had when looking through this mountain of data, a question I know you'd be asking if you were sitting right here with us.
Oh, absolutely.
If you are pumping synthetic filler or processed fat into your most intimate nerve-dense anatomy, does that fundamentally alter or, damage your sexual sensation?
That is the ultimate question. And it's fascinating because the media tends to frame all of these procedures through a very, narrow lens of vanity.
Right, you hear phrases like designer vagina thrown around constantly.
Constantly. But when you actually read the clinical sources, the reality is a deeply complex intersection. We're looking at a space where the realities of physical aging, chronic physical discomfort, and deep-seated psychological well-being all just sort of collide.
So before we can even begin to talk about sensation, we really have to understand the architectural mechanics of what we're dealing with.
Sure.
If a woman is walking into a clinic for a labial puff, what is fundamentally happening to her anatomy to make her seek that out in the first place? Let's talk about the labia majora, the outer lips.
Anatomically speaking, the labia majora are these prominent symmetrical folds of skin. They extend from the mons pubis down and converge at the perineum.
Okay.
But the crucial thing to understand about their structure is that their shape, their volume, and their firmness rely heavily on subcutaneous fat. Like any tissue in the human body that depends on fat pads and collagen for its underlying architecture, they are highly susceptible to changes over time.
And through different life events, right?
Yeah.
I mean, the sources outline a whole list of triggers for that change.
They do.
We're looking at the natural aging process, the aftermath of childbirth, massive weight loss, and especially menopause.
Yes, menopause is a huge factor.
Because when ovarian follicular activity slows down and those estrogen levels drop, the tissue physically changes. It just loses its volume and becomes deflated or lax.
And that deflation isn't just a surface-level cosmetic issue. I mean, the skin and the subcutaneous layers of the labia majora are thicker at the top and they naturally thin out toward the bottom.
Okay.
So when that volume loss occurs, which the medical literature calls labial hypertrophy, by the way.
Labial hypertrophy, all right.
Yeah. When that happens, the structural integrity of the entire vulvar area is compromised.
It sounds to me like these tissues are essentially acting as the body's natural shock absorbers.
Oh, that's a great way to put it.
Like the suspension system on a car. When the suspension is perfectly inflated and doing its job, you don't feel the bumps in the road.
Exactly.
But the second those shock absorbers deflate or wear out, suddenly you feel every single pebble. When the outer lips lose their cushioning effect, it immediately becomes a highly functional problem.
That is a highly accurate way to visualize the mechanics at play here. When that protective outer cushion deflates, it leaves the much more sensitive labia minora, the inner lips, and the vaginal opening completely exposed.
And that's where the real issues start.
Right. The clinical sources detail how this lack of padding leads to genuine severe physical discomfort for women during incredibly mundane everyday activities.
Like what kind of activities?
Women report significant pain while cycling, horseback riding, or honestly simply sitting in tight clothing like jeans or workout leggings.
Just because without that barrier, the friction is constant.
Exactly.
And the sources show that this goes way beyond just uncomfortable chafing. Because that protective barrier is gone, there is a massive spike in chronic vulvitis.
Which is women dealing with severe, constant inflammation of the vulva.
Right. And they are getting recurrent urinary tract infections too, because the vulvar vestibule isn't adequately closed off and protected from external bacteria.
Yeah, and they suffer from chronic dryness and pruritus, which is a severe, unrelenting itching.
Imagine trying to go about your daily life, sitting in an office chair for 8 hours or trying to go for a jog while dealing with chronic inflammation and pain in that specific area.
It is entirely debilitating, and this is exactly where the labial puff enters the medical picture. It is the solution designed to essentially reinflate those shock absorbers.
So looking at the literature from specialty clinics like Dr. Mileto and the Center for Surgery, they essentially offer two distinct pathways to achieve this reinflation.
They do.
Let's break down the non-surgical route first. This involves dermal fillers, specifically hyaluronic acid or HA fillers.
Right. The brand names you see in the literature are things like Deserial or Novia Rose.
So a patient walks in, a topical numbing cream is applied, the filler is injected via a cannula, and they walk out 20 minutes later.
The appeal there is obviously the immediacy. The volume is restored instantly.
But it's not permanent.
No, the body will naturally metabolize and break down that hyaluronic acid over time. The sources indicate that those results typically last anywhere from 6 to 18 months before a top-up is required.
Which leads us to the second pathway, which is much more involved, and that's autologous fat grafting.
Commonly known as a fat transfer.
Right.
And this is a minimally invasive surgical approach. A surgeon will harvest fat from the patient's own body, usually utilizing VASER liposuction on the inner thighs or the abdomen.
Okay.
That harvested fat is then meticulously purified in a centrifuge to separate the viable fat cells from blood and oil.
Wow.
Yeah. And once purified, the surgeon carefully injects those living fat cells into the labia majora.
I noticed a really specific, almost counterintuitive detail in the surgical sources regarding this fat transfer. The surgeons intentionally overcorrect.
Yep.
Like, they inject significantly more fat into the labia than the patient actually needs or wants for the final result. Why do that?
It comes down to the biology of grafting living tissue. When you move those fat cells to the labia, they do not have a blood supply.
Oh, right.
So they have to survive long enough to establish a new vascular network, new blood vessels in their new location.
Okay, that makes sense.
And the body is incredibly efficient, so it will naturally reabsorb about 20 to 30% of that transferred fat before it can successfully establish that blood supply.
So they lose a third of it right away.
Exactly. Surgeons know this reabsorption is inevitable, so they overinject initially, knowing the volume will eventually settle. The 60 to 70% of the fat that successfully vascularizes and integrates will remain there permanently.
Okay, wait, hold on. This is where I really need to push back. Because this brings us directly to the core focus of our deep dive.
Let's hear it.
We are talking about taking cannulas, needles, synthetic fillers, and processed fat, and injecting them into one of the most highly sensitive nerve-dense areas of the human body.
Yes.
Mechanically, I have a really hard time understanding how you don't just numb the whole area. Wouldn't packing that space with filler run a massive risk of burying the nerve endings or dampening the patient's ability to feel anything? Like, how does a labial puff actually impact sexual sensation?
It is the single most logical concern to have, and clinics note it is the primary source of anxiety for most women considering the procedure.
I mean, I would be terrified of that.
Right. But here is what the clinical consensus across the data and specialty clinics like Moorgate Andrology tells us. A properly performed labial puff should not negatively affect sexual sensation or function.
Wait, really?
Really. Once the initial swelling, bruising, and trauma from the injection process heal, a patient's baseline sensitivity completely returns to normal.
Okay.
You see, you are not burying the pudendal nerve network. You are adding subcutaneous volume above it.
Above it.
Okay.
Okay. But the data goes even further than that, and this is what really caught me off guard. It doesn't just return to baseline.
No, it doesn't.
Many of the sources, like the clinical data from Elite Aesthetics, report that women frequently experience a significant enhancement in sensation after a labial puff.
Yes.
They report feeling more sensitive, with increased vaginal lubrication, and far greater comfort during intercourse. If we aren't injecting new nerve endings into the body, which Obviously, we aren't.
No, definitely not.
How is that technically possible?
So to understand the enhancement, we have to look at how the brain processes pleasure versus pain. Let's go back to your shock absorber analogy.
All right.
When the labia majora are deflated and that cushion is gone, intercourse frequently causes dyspareunia. That is the clinical term for painful sex.
Okay.
The pain is caused by the physical friction, the sheer lack of cushioning, and the pulling of that exposed sensitive tissue.
And pain is the ultimate neurological override, isn't it? If you are experiencing sharp pain or burning chafing during intimacy, your brain simply cannot fully process pleasure signals. The pain demands all the neurological attention.
Precisely. By restoring that protective outer cushion through the puff, the procedure physically eliminates the pain of friction.
Ah.
When that pain is removed from the equation, the psychological and physical experience of sex drastically improves. The nerve endings were always there. They're always functioning perfectly.
But their pleasure signals were constantly being overridden by pain signals.
You've got it.
Okay, that makes total sense. And I was reading through the MedCrave expert consensus paper on the non-surgical approach, and it seems like the HA fillers are doing a lot more than just acting as a passive physical cushion.
They are.
There's a fascinating biological mechanism happening here with fibroblasts.
Yes, the chemical properties of the filler play a huge role in that enhanced sensation. Hyaluronic acid is incredibly hydrophilic.
Meaning it loves water.
Exactly. That means it chemically attracts and binds to water. It acts almost like a microscopic molecular sponge. Okay. So when an HA filler like Novia Rose is injected into the labia, it deeply hydrates the skin and the underlying mucosa from the inside out.
And as I understand it, that profound hydration physically stretches the tissue on a microscopic cellular level.
Yeah.
And that stretching is what signals the fibroblasts to activate.
You've got the exact mechanism. Fibroblasts are the specific cells in our body responsible for producing collagen.
Right.
So by deeply hydrating the tissue and stimulating those fibroblasts to generate fresh collagen, the filler actively improves the elasticity, the thickness, and the overall health of the tissue.
It's essentially anti-aging for the tissue.
Very much so. It is directly treating vaginal dryness. And since dryness is one of the most common and significant barriers to sexual pleasure, especially post-menopause,
Right.
treating it both structurally with volume and chemically with HA leads to a very real, measurable enhancement in sexual function and comfort.
So to summarize the puff, adding volume to the outer lips is generally safe for sensation because it restores the natural protective barrier, removes the pain of friction, and hydrates the tissue.
Correct.
But we have to sharply contrast this with another incredibly common procedure in our source stack, and that's labiaplasty.
Yes.
This is the surgical reduction, the literal cutting away of the inner lips, the labia minora. And the relationship between a reductive labiaplasty and sexual sensation is an entirely different, much riskier landscape.
It is comparing apples to oranges anatomically. A labial puff adds protective volume to the outer area. A labiaplasty involves physically excising or cutting away tissue from the labia minora. And the inner lips are incredibly delicate, highly vascular folds with a massive, dense concentration of nerve endings.
The clinical guidelines outline two main surgical methods for reducing the inner lips. First, there is the trim method.
Yes.
This is exactly what it sounds like. The surgeon literally trims or cuts the protruding, darker edge of the inner lip completely off, leaving a straight line of scar tissue.
Right.
And then there's the tissue-preserving wedge excision. This is where they remove a V-shaped wedge from the thickest central part of the labia and then stitch the natural outer edges back together.
And if you look at the clinical literature from places like Waterfront Hospital, they are very explicit in their strong preference for the wedge technique.
Why is that?
Preserving that natural, unbroken outer edge is paramount. By keeping the edge intact, you are preserving the natural nerve supply, as well as the natural pigmentation, contour, and texture of the patient's anatomy.
While the trim method just removes that entirely.
Exactly.
Which brings us to the most aggressive surgeries mentioned in the literature. You see the term barbilabiaplasty repeatedly in these sources.
You do.
This refers to a complete or near-complete excision of the labia minora, where the goal is a perfectly flat prepubescent appearance.
Yeah.
And the clinical warnings are stark. This level of aggressive tissue removal carries a genuine high risk of altered sensation, permanent numbness, nerve damage, and painful scar contracture along the vaginal rim.
Because the labial tissue is profoundly unforgiving. To really underscore how delicate and high risk this entire region is, we can look at a seemingly unrelated procedure in our stack.
Which one was that?
The NICE guidance report on treating Bartholin's cysts.
Right, right.
These are functional, fluid-filled cysts that occasionally develop near the vaginal opening. Doctors frequently treat them by inserting a tiny, soft silicone balloon catheter to drain the fluid over a few weeks.
I mean, it sounds incredibly straightforward. A tiny, soft balloon.
It sounds simple, right?
Yeah.
But the NICE safety data from a series of 68 women showed that even the improper insertion of that tiny, soft balloon caused devastating complications.
Wow.
Just the pressure of a misplaced silicone balloon caused it to erode right through the cutaneous surface of the labium.
Oh, my gosh.
Yeah, leading to necrotic abscesses, meaning the tissue literally died and became infected.
That's terrifying.
Another woman in the study had to be hospitalized for 9 days simply because the catheter slipped out of place between the mucosa and the cyst wall.
A necrotic abscess from a soft, misplaced balloon. That perfectly illustrates the stakes here.
It really does.
It completely recontextualizes the strict, almost severe warning we saw from the Tweakman's Guide in our source stack. They explicitly state that any injectables, even just fillers down there, must be performed by a true, board-certified gynecological expert,
Absolutely.
not just a general esthetician who took a weekend course on facial fillers.
The vascular anatomy alone dictates that level of expertise. I mean, you have the pudendal and perineal arteries sitting right there in the lower third of the labia majora.
Right.
If a practitioner who does not deeply understand gynecological anatomy accidentally injects a thick hyaluronic acid gel directly into one of those arteries,
Oh,
it immediately blocks the blood flow to the region.
which leads to...
That can lead to catastrophic tissue necrosis, or in severe cases, systemic embolism. The stakes are incredibly high.
So if we look at the whole board here, we've established that the anatomy is delicate, the tissue is unforgiving, the surgical risks are very real, and the potential for severe nerve damage or vascular complications is absolutely present.
Yes, all of that is true.
If all of that is true, why is the demand for these procedures exploding the way it is? The data from the British Association of Aesthetic Plastic Surgeons shows a massive 50% increase in labiaplasty procedures in the UK alone over just a few years.
It's a huge jump.
What is driving women to take these risks?
This is where we have to transition from the physical realities of the surgery table to the intense psychological and cultural pressures driving the market.
Right.
Government and parliament reviews, alongside the surgical associations, consistently point to a very specific cultural driver: the ubiquitous, inescapable influence of pornography and highly edited, explicit imagery.
You combine that flood of homogenized imagery with a severe lack of baseline education about what normal genitalia actually looks like,
Right.
and you create a perfect storm for widespread body dysmorphia.
Exactly.
We talked about medical brochures and textbooks at the start of this deep dive. The reality is that there is no single normal for labia minora.
None at all.
They vary wildly in shape, size, degree of asymmetry, color, and texture. It is as unique as a fingerprint.
And that realization is exactly what birthed the labial pride movement.
Right.
It is a concerted effort by medical professionals and advocates to fight back against this narrow, media-driven, surgically altered ideal.
It's so needed.
They are working to educate people that what they are seeing on a screen has almost certainly been digitally airbrushed or surgically flattened, and it simply does not represent the vast, completely healthy spectrum of normal human anatomy.
It brings me right back to that jarring contrast in our source stack that we mentioned earlier.
Oh, the kidney surgery?
Exactly. Sitting right next to the glossy brochures for walk-in labial fillers, we had this incredibly dense clinical overview of laparoscopic nephrectomies from NICE, the surgical removal of an entire human kidney.
Yeah.
It seemed like such an outlier to have in this stack.
It seems disconnected, but it actually highlights one of the most profound shifts in modern medicine.
Exactly, because what the nephrectomy document shows is the triumph of minimally invasive technology.
Right.
By using laparoscopy, making tiny incisions, using microcameras, and highly precise instruments, surgeons revolutionized a massive, incredibly traumatic, life-saving surgery.
They really did.
They dropped the required hospital stay for a kidney removal from 12 days down to just 3 days. It is a genuine medical miracle.
But the presence of those two documents side by side raises a critical question for the medical community. What happens when that exact same technological leap, the ability to do highly complex things to the human body with minimal invasion and rapid recovery, is applied to elective cosmetic desires?
The same technology that makes kidney surgery safer has made elective intimate surgeries so accessible that they are now marketed with the exact same language as haircuts and manicures. They are branded as walk-in, walk-out lunchtime procedures with zero downtime. You literally have high street clinics offering 0% financing on a 5-year payment plan for a labial puff.
It's
It
wild.
feels like a fundamental shift in how we view healthcare.
Because the lines between major medical intervention, functional restorative care, and casual cosmetic touch-ups have completely blurred.
Right.
When a procedure is fast, relatively painless, and accessible on a payment plan, the psychological barrier to altering your body permanently disappears. It transforms a serious medical procedure into a casual consumer product.
So what does this all mean for you, the listener, as you navigate this rapidly changing landscape? Let's summarize the key takeaways we've unpacked today.
Good idea.
The labial puff, utilizing either hyaluronic acid fillers or an autologous fat transfer, is a minimally invasive way to restore crucial volume and function to the labia majora, the body's natural shock absorbers.
And crucially, when performed correctly by a specialized expert who intimately understands the complex vascular and neurological anatomy, it does not numb or damage your sexual sensation.
In fact, for many, it enhances it. By physically removing the pain, the chafing, and the friction of daily life and intimacy, and by chemically hydrating the tissues to stimulate collagen,
Right.
it allows the brain and body to actually experience pleasure without the constant overriding distraction of physical discomfort.
However, the wider world of female genital cosmetic surgery, especially reductive, cutting surgeries like labiaplasty, requires navigating very real physical risks and intense, often toxic cultural pressures.
It really does.
It forces patients and doctors alike to constantly evaluate their motivations. Are they treating a genuine physical symptom, or are they surgically treating a psychological insecurity born from entirely unrealistic media standards?
It's a complex, highly personal landscape to navigate. And it brings us full circle to those medical diagrams and textbooks we started with. We're living in an unprecedented era where we have the technological ability to physically edit ourselves to match an artificial blueprint.
Which leaves us with a final, rather provocative thought to mull over.
Okay, let's hear it.
We've seen today that the medical definition of a functional procedure versus a purely cosmetic one is already incredibly blurry, especially when deep psychological distress is involved.
Sure.
As virtual reality, augmented beauty filters, and highly edited digital media become even more immersive and ubiquitous in the coming decades, how long will it be until the medical community is forced to completely redefine the baseline of normal human anatomy?
Wow.
Simply because our digital avatars have convinced us that our natural, perfectly functioning bodies are inherently flawed.
Something to think about the next time you look at a perfectly airbrushed image. Thanks for joining us on this deep dive.